From empowerment initiative to quality healthcare delivery. This time, Governor Babajide Sanwo-Olu has disclosed that his administration is shifting its focus from delivering healthcare projects to building enduring systems that will guarantee quality, accessible and affordable healthcare for generations. He made this known at the Eko Health Convention 2026.
Medical professionals in the public and private sector, policymakers, development partners converge on Oriental or Victoria Island, Lagos for the Eko Health Convention 2026 to chart a way forward on building a healthier Lagos with digital innovation. The convention tells the story of a health system that is continuously evolving to meet the needs of the state's growing population.
Our maiden edition was last year and it was themed Driving Innovation, Strengthening Systems, Leading Change. We focused on our health system and on how we managed the need to strengthen it and where we needed to be. This year, our theme is building a healthier Lagos, connecting access with excellence. And that is exactly what we've been doing this past year. Our framework has been the H in Mr. Governor's Theme Plus agenda, access to affordable quality healthcare. We made a commitment to Lagosians that we will transform health privilege from a privilege into a right, from out-of-pocket to insurance, from paper to data, and from reaction to prediction. Today, I am proud to report that we have moved from commitment to implementation.
And so it's not so hard to dream that, and since Mr. Governor's first dispensation, and now we're in his second dispensation, it's getting easier and easier to see that imagination manifesting. On my desk, I have so many requests for doctors in the diaspora looking at the great projects that we're doing, the Massey Children's Hospital, the Ojo General Hospital, the Mental Health Institute, the formation of the transmutation of LASUCOM into the standalone University of Medicine and Health Science. We're beginning to have and make sophisticated diagnoses and treat lots of diseases that people had to go abroad, to India, to Dubai, to South Africa. We're beginning to do them here in Lagos, both in the private and in the public sector.
Ensuring access to affordable and quality healthcare for citizens through health insurance scheme remain top priority for the government.
Indeed, how do we ensure that the scheme remains sustainable in the medium to long term? Intelligence is gathered actuarially and analytically, and it helps us to make better decisions, helps us to improve service delivery, and bring healthcare even closer to the people. In conclusion, ladies and gentlemen, full disclosure, the Osenis, they are fictional because in Lagos we have data protection. But there are several families living these stories every day. Stories that where healthcare begins with dignity, emergency begins with compassion, and innovation is helping to remove barriers instead of creating them. That is what Eko offers. Where digital innovation is not existing just for technology itself, but it is designed to protect lives, to strengthen families, and to advance universal health coverage. Where quality healthcare is not determined by your income, your geography, or even your circumstance. Because at the heart of every digital innovation is not just a mobile application or a portal, it's actually a human life. And when that life is protected through innovation, then Eko becomes more than a health insurance scheme. It becomes peace of mind, it becomes dignity, it becomes hope. That is the Eko reality.
We are talking quality of healthcare, and you're not now talking just about the patients. We're also talking about the healthcare workers who are going to provide this healthcare. What is the sense of quality that we have? Because quality is not just about who has the biggest hospital or the finest hospital. We've seen examples of that in Lagos. It's about the workers in the hospital and what is their commitment to quality. It's about the culture within that hospital and what does the culture say in that hospital. Do all the staff in that hospital say, tomorrow, how can we make healthcare in this hospital safer and better than it was the last time? After that, we'll look at how the health districts are bringing healthcare closer to the people, because that is the true access.
The State Deputy Governor, who is also the flag bearer of the All Progressives Congress for the 2027 governorship election, responds to questions on the performance of the state health sector and outlined plans to further improve healthcare delivery.
Oh, absolutely. So, I mean, like we said before, so we used to have like 2 major maternal center, I think Eko House and Massey. So, but the essence is to make sure that Lagos, as it's expanding, how do we take these things to the people? And like I said, we look at courts. So traffic in Lagos is also because people move from, say, Ikorodu to come to Ikeja, for courts. They come to Ikeja for health. They come to, so the idea is how do we take it to the people in different areas? And that's the essence. And more importantly, how do we provide neonatal, pediatric services under one roof, so that at least mothers and children, these hospitals are closer. And I think at the time, the Ministry of Health gave us a presentation that shows that if you have a 100-bed MCC, you cut maternal child mortality by about 42%, if my memory serves me right. So basically, if we are able to do that more, and we are actually reducing child maternal mortality in our state.
Governor Babajide Sanwo-Olu says sustained investment in the health sector is yielding positive results. According to him, over 1 million residents of Lagos are now enrolled in the state health insurance scheme called the Eko, but the figures must improve to reduce out-of-pocket medical expenses.
Every retelling is a chance for error. Every repeated test is money that a family or a state don't need to spend. So what it means is that with our SHIP program, all we need to do is to start, a record from the very first place that you go to, which could be primary health facility anywhere in the state. And for whatever reason, you need to access health again in another general hospital that is far off from your primary health, your records will just be popped out and we'll see. And eventually, if you need a tertiary health care treatment in our tertiary health structures, similar records also will be there. And what that means is that from a single source, every of our health facilities can access your record. And I think that is the way to go. That is one of the major things that this administration will leave behind when it moves on.
The Lagos State government says its doors remain open to more partnerships aimed at building a stronger, innovative healthcare system that delivers better outcomes for the people. Awards of recognition were presented to the Commissioner for Health, Professor Aki Abayomi, Special Advisor on Health, Dr. Kemi Ogunyemi, and other senior officials of the State Ministry of Health in recognition of their outstanding performance and contributions to strengthening healthcare delivery in the state.